legislation and with other interests. I think that we are looking at a climate which, as the bill that was passed unfolds, there'll be plenty of room to talk about what we could do differently. As the bill that was passed creates openings at a state level, there'll be plenty of time for us to help to spur state single-payer efforts. As the state single-payer efforts move forward and may reach any roadblocks, Mr. Conyers and I and others are prepared to seek legislative redress at the federal level to help the states. So I think this is a moment that our coming together becomes essential, that we make a new beginning. We'll continue to work with you and continue to follow your leadership on this absolutely critical social and economic concern that affects the lives of all Americans, and will continue to, notwithstanding whatever legislative remedy is brought to bear in the next few years. Thank you very much.
And Healthcare Now was an organization that was formed shortly after HR 676 was introduced in 2003. And Marilyn Clement, who was the founder of it, passed, and tragically, and Katie kept Healthcare Now alive. And she had the office in New York City, but they recently moved to Philadelphia. But there are literally hundreds of organizations that are part of the Healthcare Now organization, and we're glad that you came from Philadelphia to speak to us today. So thank you very much for coming.
Everyone, thanks for the introduction. Yes, I come to you from Philadelphia. We have relocated our offices there. Healthcare Now was founded as a single-issue organization in 2004 to push HR 676, expanded and improved Medicare for all. So over this past, the effects of that now in the current health law that exists. We worked very, very hard to educate and advocate and agitate for single payer over this past year. And I think what happened was, through leveraging, mainly through our exclusion from this process, we were able to, at least within Congress and throughout the public, show the difference between the weakened position that many people took of the idea of a public option, you know, that this idea that people want a choice between private and public insurance. We were really calling that out as a false choice. People want a choice between their doctor and their hospital, which a single payer expanded and improved Medicare for all would give. So the nature of the national discussion, unfortunately, was reduced to a false choice, and ultimately the challenge to have a fair and open hearing and discussion within these buildings here in Capitol Hill is still before us. I've been traveling around to strategy meetings held by single-payer activists across the country. I've been to meetings in Massachusetts, Illinois, Ohio, Pennsylvania, New York so far, and more are being planned. And there's some consensus being built about what needs to happen, understanding that the movement for single payer needs to be independent of the kind of political winds that happen here in DC, because the political, what it seems politically feasible does not translate into good health policy, as we see. We need to make sure that this movement is educated and ready to go out of their comfort zone to fight for the health care we need. There's no shortcuts to this. So we're not going to see a bill easier with a public option as we saw in this last Congress, right? We should start by framing the discussion with the absolute strongest position, which is truly universal, comprehensive, guaranteed care for all without financial or other barriers. Also on the wish list for what we have moving forward is legislation that stands up to a Congressional Budget Office score. We also need the resources to do a real economic impact study that will allow advocates in the street to be backed up by the real numbers that this legislation could provide in terms of savings, in terms of coverage. We do need to keep this in the national spotlight, even though there will be probably resistance to talking about what to do about healthcare now that our country has gone through such a long and involved debate over it over this past year. However, the demand for universal healthcare needs to be raised through the 2010 elections. We need to continue advocating in our communities for this. Ultimately, I hope that we can hear from our members of Congress about how they can be accountable to the movement which is committed to these principles, what went into the political analysis of actually taking single payer off the table from the beginning when we were the health policy that was supported by the majority of Americans, physicians, nurses, and labor around the country. And in terms of what next steps we have, I do see some short-term goals to continue to support the activists around the country who are calling out the immediate impact of our healthcare system on regular folks. And in Cleveland, Ohio, there's some amazing activists rallying around the firing of 2 very good primary care physicians from a Cleveland hospital system. They're being fired ultimately because they're good doctors and they take time with their patients and therefore they're not profitable. And the activists are organizing and pressuring, getting it in the media, as well as a demonstration just coming up this Sunday, calling out the firing of these doctors as a foreclosure on 2,500 patients' medical homes. And the action is pretty creative. Apparently they're going to have people in cardboard boxes imitating homeless people as if homeless for our medical homes. But these are opportunities that are going to continue happening around the country. We need to be really vigilant as activists going forward that we highlight that in a for-profit system, the continuity of care, the quality of care is always going to be reduced. And that's what Healthcare Now is committed to doing going forward. And I look forward to the discussion and hearing from everybody else on the panel. Thank you.
So thank you very much for coming.
Thanks. Honored to be here. There's been a few meetings we've had over the course of the last year, and we're truly down to the hardcore here this afternoon. So I thank you, for those who have not given up on the fight, and Congressman Conyers for your leadership, and Joel for keeping the rudder moving. Progressive Democrats of America, for many of you who may not know, was founded during the 2004 National Convention when the Democrats met. We were very disappointed that Dennis Kucinich never got the real debate that we hoped for during the primary season. Our party made a decision to elect a candidate and not have a debate. And we began in 2004 to continue that debate, and here we are today. And I don't think it's any accident that both Congressman Kucinich and Congressman Conyers were the 2 first speakers when Progressive Democrats of America was founded. We are the Democrats that truly believe that single payer is the way to go. And we're going to continue to do everything we can inside these halls and inside the Democratic Party. We also have learned enough throughout history, beginning, I guess, starting right with Shea Chevalier and Thomas Paine, that we need an inside-outside strategy. And we figured that out very early on in PDA. What we mean by inside-outside is that we need the Russells of the world, the Single Payer Network, and the Katies of the world, as she said, to have an independent movement outside these halls, to put the real street heat on, to force Congress in its action. I think while we are looking forward and not through the rearview mirror this afternoon, the one piece that we need to own, everybody in this room, our frustrations that single payer has taken off the table, is that each of us individually in this room, as much as we fought to put it on the table, need to take responsibility, because in the end, we failed to give the true numbers to those who are fighting inside the hall. So when you talk about what we can do to make the caucus stronger, what we can do in Congress to make single payer stronger, we believe in PDA is to keep the street heat on and elect candidates like Marcy Winograd, her challenging Blue Dog Democrats, who took single payer off the table and only paid lip service to the Kucinich movement long before time we even advocated Congress. I'm honored that Marcy carries that banner as part of PDA. I'm honored also that there are other PDA activists in the room. I just want to acknowledge we are a grassroots organization and we're organized by congressional districts. We believe that by organizing by congressional districts, we can bring that street heat into our members of Congress and then force that inside piece by meeting with our members of Congress. Andrea Miller out in Virginia, who's leading our effort out in Virginia. I want to